Hello everyone! Welcome back to my YouTube channel, the MCL Charge Capture and Coding.
Welcome!
Presenting my new video lecture series on abscess drainage procedures. I am so glad that you are here and you can join me as I begin with part 1, and our focus for today's lecture is the incision and drainage procedure. But full disclosure before we proceed, the sources of my lectures are the CMS website, National Institutes of Health, library.com, and our CPT and ICD-10-CM codebooks. I will mention other resources as we go along with our presentation. And please note that all my lectures are from a billing and coding perspective. So, let us begin. Agenda are as follows. To know the definition of abscess drainage. Define abscess and discuss its nature and identify its different types. We will learn what the 4 types of abscess drainage procedures are, which we will discuss in detail as I present them to you by procedure, which shall comprise our 4-part lecture series. And that, of course, brings us to our Part 1 presentation for today, which revolves around the incision and drainage procedure with the current CMS documentation requirement and updated billing and coding guidelines. Abscess drainage. According to the website of Library, abscess drainage is a medical procedure used to remove pus or other fluids from an abscess. An abscess is a pocket of infection that forms in the body when bacteria, fungi, or other germs invade and inflame an area of tissue. Reference to the CMS LCD reference article L33563, here are the different types of abscesses. Carbuncle, cutaneous or subcutaneous abscess, cyst, furuncle, paronychia, post-operative wound infections, and suppurative hidradenitis. Mentioned earlier, there are 4 types of abscess drainage procedures that comprise my 4-part lecture series. Incision and drainage procedure is the most common type of abscess drainage. This is what our Part 1 presentation is all about. The other 3 procedures are needle aspiration, catheter drainage, and surgical excision, which will each be presented in our upcoming video lectures, namely Part 2, Part 3, and Part 4 respectively. Do you know what causes an abscess? Let us talk about the nature and causes of abscess according to the webmd.com or webmd.com website. Abscesses are described as painful and warm to touch. They are known to appear on any place on your body, but mostly noticed on the skin in the armpits or axillae. The abscess found in areas around the anus and vagina are commonly called Bartholin gland abscess. The abscess on the base of the spine is called pilonidal abscess, while around the tooth is the dental abscess. Abscess is not like any other infections that can easily be treated with antibiotics. As I've discussed earlier, you now know that abscess is mostly treated with an incision and drainage procedure. When our normal skin barrier is broken, even from minor trauma or small tears or inflammation, bacteria can enter the skin. An abscess can form as your body's defenses that try to kill these germs with your inflammatory response. Obstruction in a sweat or oil or sebaceous gland, or a hair follicle or a pre-existing cyst can also trigger an abscess. The middle of the abscess liquefies and contains dead cells, bacteria, and other debris. This area begins to grow, creating tension under the skin and further inflammation of the surrounding tissues. Pressure and inflammation cause the pain. This is still with the same website reference, webmd.com. So, in this slide, we will talk about which group of people are most vulnerable to have skin abscess. Generally, severe abscess most often occurs in people with weakened immune system because they have decreased ability to ward off infections such as follows: chronic steroid therapy, diabetes, AIDS, PVD or peripheral vascular disorders, ulcerative colitis, severe trauma, obesity, chemotherapy, cancer, sickle cell disease, Crohn's disease, severe burns, and alcoholism or IV drug abuse. Let's begin with today's topic. So usually, the physician will first inspect the condition of the abscess and might classify it as either a skin abscess, for which some of you may know as cutaneous or subcutaneous abscess. This is very common for incision and drainage or puncture aspiration, but perhaps your physician may classify it as an internal abscess, which is harder to diagnose because it is more severe. The physician may also prefer to perform an ultrasound imaging to help in diagnosis. For patients with personal history of intravenous drug use, the physician may recommend radiological exam or an X-ray just to ensure that there are no remaining foreign fragments in the area, like needle and other materials for drug use, per wikipedia.com. Incision and drainage is covered procedure for treating abscesses, but this procedure on non-abscess fluid collections may also be covered if it was because of the presence of signs and symptoms such as pain, inflammation, or infection that the physician deemed it medically necessary to perform. Otherwise, it would have presented more harm to the patient if mere conservative measures were opted. This is according to CMS Local Coverage Determination, reference article L33563. What are the benefits of abscess? Why should people seek medical attention to undergo the incision and drainage procedure? According to Librate.com, incision and drainage procedure relieves the patients of pain and discomfort. It reduces risk of complicated infection, it improves healing time, and most importantly, it reduces the risk of organ damage. Based on our agenda, now we know what abscess drainage is. We have also defined abscess. We discussed its nature and identified its different types. Then we learned of the 4 types of abscess drainage procedures. To be in compliance with CMS, CPT and ICD-10-CM, now let us talk about the documentation requirements and the current billing and coding guidelines when reporting an incision and drainage procedure code. For CMS LCD reference article A56766, first, there must be an established medical necessity. Your physician's progress notes must include, but not limited to, relevant medical history, physical examination, and results of pertinent diagnostic tests or procedures. The signs and the symptoms, like pain, infection, and inflammation that led the physician to decide to perform the procedure must be properly documented. Medicare and some payers may require a detailed description and photographs of the abscess and its surrounding area. This is especially when there seems to be a pattern of billing repeated incision and drainage services of the same anatomical area. The description of the appearance in the documentation must reflect what is shown in the photographs. It would be best to make them available and ready when requested. For your information, if a patient requires incision and drainage services repeatedly or more than once for the treatment of abscess in the same anatomic location, the medical record must clearly reflect the reason or reasons for the persistent or recurrent infection and what measures are being taken by both the physician and patient together to avoid infections. This is according to CMS LCD reference article A56766. About the progress notes. Remember to look out for the following information in your physician's progress notes or operative report: the preoperative size of the abscess, the location of the abscess, the equipment and material used by your physician during the procedure, and the description, such as in quantity of the blood is 1 cc or 6 cc of blood, and by the quality of the fluid drained. Like it may be stated, for example, that the quality was serous or serosanguinous or malodorous. Coders who code podiatry when the indication was abscess involving pus-producing paronychia without ingrown nail and the podiatrist performed an incision and drainage procedure or puncture aspiration procedure, reference your CPT code and look for codes 10060, 10061, and 10160. Then, select the appropriate code according to its description that justifies the procedure notes. Remember, there must be no ingrown nail involved if you are reporting these codes. If you are coding orthopedic, CPT codes 10060, 10061, and 10160 are also used when the procedure was performed on the fingers. For reference, these are the complete or detailed procedure descriptions of CPT code 10060, 10061, and 10160. Make sure you append the appropriate digit modifier. This list shows the applicable hand and finger modifiers when reporting the incision and drainage or puncture aspiration procedure involving the hand or the finger. Just the same, if the procedure involves the foot or the toe, refer to the list of applicable modifiers shown here. Note that the permanent correction of recurring ingrown toenail by nail resection or wedge excision of the nail lip, we report and bill this procedure with CPT code 11750 or 11765. Do not use the incision and drainage or puncture aspiration procedure CPT codes. If your provider can sufficiently treat paronychia with only the nail avulsion procedure, bill and report the procedure with CPT code 11730 plus the add-on code 11732 if more than one toenail plates are involved, because remember, this too should not be reported as an incision and drainage procedure either. Again, remember that procedure codes may be subject to National Correct Coding Initiative or NCCI edits or OPS packaging edits. Refer to NCCI and OPS requirements prior to billing Medicare. We use 10060, 10061, and 10160 CPT procedure codes for incision and drainage of pus-producing paronychia without ingrown nail. We use 11750, 11765 for permanent correction of recurring ingrown toenail procedure. For treatment of paronychia with nail avulsion procedure, we report 11730 and 11732. and please do append a modifier when applicable if the procedure was performed on the hand or the finger, or the foot or the toe. From our agenda for Part 1 lecture, we learned the definition of abscess drainage, defined the abscess, and discussed its nature and identified its different types. We also learned the 4 types of abscess drainage procedures. Now, from the previous slides, we discussed the incision and drainage procedure in detail by discussing the documentation requirements posted by CMS and also the billing and coding guidelines according to our CPT codes and the modifiers required to be appended on the codes. And that wraps our lecture for today about the incision and drainage procedure. Thank you very much for learning with me. Happy coding! Next is our Part 2 video lecture presentation on needle aspiration procedure. We will talk about this procedure in detail along with its billing and coding guidelines as well as the documentation requirements published by CMS.